Do you want to know how to select the perfect physical therapy clinic after the surgery? You need somebody who's going to be there for you, get you back to 100%, and that's a huge decision to make. So today I have Dr. Sanders here from the Sanders Clinic, and he's going to shed some light on how he selects the PT clinic to send his hard work to. So here's Dr. Sanders, and what do you think?
Well, the first thing is just by way of myself, I'm on this 24/7, and I care deeply about doing great work. And I have to find a physical therapy clinic that is going to pick up on my great work and do great work, because unless I can partner, and I and my patients can partner with some really good physical therapy people, we're not going to have the result that I promised them.
For sure.
So the first thing is select the physical therapy place before your surgery. Interview a couple. Find out how dedicated these people are, because what we don't want, and especially in today's times with the way insurance is, we don't want people to get the bum's rush so someone gets a few codes on the insurance. That's a guarantee for bad results. And the other thing is that we need somebody a therapy place that is going to deliver. What do I consider deliver? Well, getting somebody walking in a few days after ACL surgery without crutches. In a week or 10 days, being able to touch the back of your butt with your heel in terms of getting the knee to flex all the way, and be able to have extension in the knee equal to the opposite side. That doesn't come automatically, and you need to have someone who really cares about what they're doing. And in my experience, talking to several different places before, you will know who cares about what they're doing. And I also recognize that sometimes it's going to take a car ride out of your zip code to find the right person. And the one reason not to go to a doctor or not to go to a particular physical therapy clinic is because you don't want to leave your zip code.
Right. Well, to speak to the interview process, I know our clinic, we have several options where the patient can come into the clinic and get a free screen. We're more than happy to jump on phone calls for that could last 15 to 20 minutes. We put up that work up front to make sure, first of all, that we're a fit for our patients. And we're actually just rolling out a new online consultation where we can actually see them move, get that face-to-face time, and make them, let them see the value first, let them kind of get a taster, and if they feel like it's a good fit and we feel like it's a good fit, then we can move on with the rehab. So 100% agree with you there.
Well, I think you're on the right track, and I will say that my patients that have seen you guys have been very pleased, and I have seen some pretty incredible numbers in terms of they came in, they had range of motion from 0 to 90 3 weeks after their ACL, and after 2 sessions they had motion from 0 to 130, and the fact is they could have had 0 to 130 2 days after their surgery if they had therapy that was done properly, as opposed to somebody who just you came in, you laid on the table, some nice lady put a warm rag on your knee, and then an hour later you left.
Right. What are your feelings about kind of high volume clinics and with a bunch of assistants and even students seeing your patients? I mean, obviously there's a need for that, but what's your personal opinion about that?
Students are always important, because students keep you on your toes, and you have to do the right thing in front of them. So I don't have a problem with students. Students can certainly help, and they can certainly observe. But when you got too many assistants and you got a therapist that's running 5 rooms at a time, that doesn't work. You need to have a one-on-one type of experience. Because really, the therapist, you're going to see the therapist, say, 3 times a week for an hour. And of course, there's 168 hours in the week, and 3 hours you're with the therapist. And of course, you got to be doing this homework on your own, the other 165 hours a week. Absolutely. But if you're 3 hours a week, really is only 20 minutes, because they're busy with assistants the whole time, putting hot and cold rags on the sore parts, then you got nothing except somebody taking your insurance money.
For sure. Yeah, we see all of our patients for a whole hour, one-on-one with a doctorate level clinician and at Sculpt U. So our patients really appreciate that time, and as a result, we actually see them less frequently. People have lives too. They don't want to date us for 3 months. Once or 2 times a week is usually enough with a home program at our facility.
Well, the most important thing is the home program.
Absolutely,
But to get that home program right, you do need to check in once or twice a week. And that does make it easier for people that are coming from other zip codes.
Yeah, absolutely. Well, that was great. I hope you guys found that helpful. I'm going to go ahead and tag Dr. Sanders' clinic at the bottom with his website and his phone number if you'd like to learn more about him. If you'd like one of those free consults, whether a phone call or just stop into the clinic, go ahead and send us a message and we will reach out to you and get that going. So thanks, guys.